Hello everyone, this is Dr. Nikita Consul from the Academy of Online Radiology Education. I'm a radiology resident at Baylor College of Medicine in Houston, Texas. For this month's liver imaging blog, we have actually curated articles from both September and October of 2020. In this study published in European Radiology, percentages of HCC versus non-HCC were calculated from pooled meta-analytic data of cases with LIRADS tumor in vein. 70.9% of these cases were due to HCC, while 29.2% were due to non-HCC. Cases with hepatitis C of note had higher pooled percentages of HCC as the underlying cause for the tumor in vein. HCC was found to be more commonly an underlying etiology for LIRADS tumor in vein category than non-HCC, but this was found to be contingent upon the reference standard, geographic differences, and study design. Please read the blog entry for further information on this article. This was another article published in European Radiology. It was a prospective study evaluating gadoxetic acid-enhanced MRI in 103 HCC patients who had a score of LIRADS 5 and had early recurrence within 2 years after surgery after resection with curative intent. 53 of these 103 patients had early recurrence and also were found to have associated MRI findings that included corona enhancement, peritumoral hypointensity on hepatobiliary phase, and satellite nodule. Patients were stratified into the LR5A, LR5B, or LR5C categories based on the number of predictive findings that they had. And these were found to correlate with 2-year disease-free survival of 65%, 39%, and 6% respectively. This article, published in PLOS ONE, was a prospective comparative study of cardiac motion artifact on the MRI DW scans obtained in inspiration and expiration, done in 43 patients who had known or suspected focal liver lesions. Normalized signal in inspiration was found to be slightly higher than in expiration without any statistical significance. Qualitative evaluation showed no differences. And so in conclusion, no significant difference in pulsation artifact over the left hepatic lobe on DWI sequences during inspiration was seen when compared to expiration. In this study published in the AJR, semi-automated liver surface nodularity quantification software was developed and evaluated for accuracy against the calculated Metavir score. The LSN score and Metavir score had high correlation, with areas under the curves for LSN within the range of 0.83 to 0.98. The LSN score calculated semi-automatically based on the algorithm developed by the authors, therefore was concluded to have high accuracy and correlates with the pathologic fibrosis stage. In this study published in Radiology, the relationship between MRI findings in the liver parenchyma peripheral to colorectal liver metastases and pathologic vessel, as well as bile duct invasion, was assessed. 148 of these CRLMs in 106 patients were evaluated. Bile duct dilatation peripheral to the tumor was associated with pathologic portal vein and bile duct invasion, as well as poor recurrence-free and overall survival. A combination of early enhancement, reduced gadoxetic acid uptake, and bile duct dilatation peripheral to the tumor was therefore predictive of poor overall survival. For more details, you can read our blog where you can find links to these original publications. Please feel free to share your thoughts and questions with us on the Liver Imaging Forum, and see you next time.